Which is hard to
This is the story of two rooms. 2 rooms, 2 miles apart. No one in here knows anyone here, but they're connected. We all are.
How is your well-being?
The pair in this room are conversing. The near dozen in this one, mostly laughing. All are addressing the same reality. They're in the field of mental health and social work, and they're worried about the future.
We all catch ourselves burning out.
Let's start with Bella Levitt. She's a second-year grad student at Oakland University, just north of Detroit. She's chatting with Maria Beam, who runs the social work program, about what she's seen so far.
My last internship was at a high school, and even the high schoolers, there were so many people on me and my supervisor's caseload that we couldn't give everyone the adequate care that we wish we could have.
By all projections, a shortage of staff in social work and mental health had already loomed before the COVID-19 pandemic. Since the pandemic, those issues haven't changed, and the demand has exploded. Last year, the American Psychological Association conducted its annual survey of those in the field. 79% reported an increase in patients with anxiety. 66% reported an increase in patients with depression. But just as instructive was what they said about themselves. Nearly half said, "I have not been able to meet the demand for treatment from my patients." Almost as many said, "I feel burned out." Which takes us to this room. The individuals laughing and letting off steam are the same ones with social work slogans on their shirts. They are social workers at Easterseals MORC, 2 miles away.
The trauma continues to come out.
Brent Worth is the organization's CEO. The people in the room use these meetups for a much-needed release.
They don't want to just change lives, they want to save lives. And so when they're seeing so many different people and their caseloads are 30% too high, that takes a toll on their own mental health.
There's one more way these rooms connect, a partnership that would offer paid internships for Oakland University students at Easterseals MORC and 10 full scholarships for OU grad students. It was announced this spring.
Many students will kind of get that real world exposure and experience of what is happening.
We're going to get people excited and want to work in this field. They want to commit to us, we're committing to them.
The collaboration might add a few more names to the social work roles. Similar plans in Congress aim to fund hundreds of residencies for new psychiatrists each year. But it will take many plans in many rooms to meet a need that connects us all.
One of my professors asked me, "What do you really want to do?" And all I could say was that I wanted to help people. To me, people who reach out for social work services often just need somebody to listen.
In Auburn Hills, Michigan, I'm Matt Pearl.